Good evening and welcome to the Sierra Nevada Forum. Our mission is to provide facts on issues important to our community. We would like to thank our co-sponsors, the League of Women Voters of Northern Nevada, the Capital Branch of AAUW, and the Nevada Appeal, who are recording this. Our format is as follows. Our speakers will present information about the work they do and answer the many questions we ask them ahead of time. As they talk, people will circulate in the audience with index cards. If you have a question, write it on the card and it will be collected and passed to a screening panel. They will eliminate duplications. Then the presenters will answer the questions. Restrooms are past the lobby to my left, and please silence your cell phones. Our future forums are going to be on March 12th. It's aging, everyone's doing it. And on May 14th, hopefully something about our infrastructure. So, our speakers tonight are from the Nevada Department of Health and Human Services, Division of Welfare and Support Services. Carissa, is that right? Carissa Loper Machado is the agency manager of Child Care and Development. Tanya Stevens is the Social Services Chief of TANF, SNAP, and Medicaid. And Marlon Workman-Meshberger will speak about employment and support services. And special thanks to Crystal Musley, Public Information Officer, who arranged our speakers. We're going to start tonight with Tanya.
Hi everyone, I'll just quickly run through the agenda. We plan to identify the programs provided by DWSS, provide basic factors of eligibility for the programs, and also how to apply for DWSS programs, Divisional Welfare and Support Services. I'm going to go ahead and start with our SNAP program, and that stands for the Supplemental Nutrition Assistance Program. That's a federal program implemented through our state agency. The federal government, I'm going to try and cover some of the questions that were asked within the presentation, so you'll find some of that information throughout. The federal government pays 100% of the SNAP benefits to our customers. Administration costs are shared 50-50 between the state and the federal government. The Supplemental Nutrition Assistance Program, SNAP, provides food benefits to low-income families to supplement their food budget. Again, those funds are meant to supplement. We encourage that they reach out to other entities as well, and we refer as well to help them further supplement their needs. It's a resource to address food insecurity. And some of the eligibility factors include verifying income, having Nevada residency, we check for duplicate assistance, and we verify citizenship or qualified non-citizenship status. Behind me are the SNAP income limits. Those change annually. And we update those based off of the federal poverty level, which is determined by the federal government. So currently, you can see we break it out by household size and gross federal poverty level. And then to your right, it'll show what the maximum allotment amounts are for a household of 1, 2, and so on. You can also access this information at www.dwss.nv.gov. Next program I'm going to talk about is TANF. That stands for Temporary Assistance for Needy Families. Through the TANF program, there are 4 purposes of TANF that our program strives to meet. Those purposes were developed by or determined by the federal government. Those include provide assistance to needy families so children can be cared for in their own homes or in the homes of relatives, and the dependence of needy parents on government assistance by promoting job preparation, work, and marriage, which Maria will talk about in a little while. Prevent and reduce the incidence of out-of-wedlock pregnancies, and encourage the formation and maintenance of two-parent families. The TANF block grant totals just under $44 million, roughly $43.8 million to the state of Nevada. I have some numbers as well. These numbers are based off of 2021 spending. We show that, and this information came from the Center on Budget and Policy Priorities. So in 2021, we show Nevada spent approximately $115 million in federal and state funds, and that would also include what we refer to as maintenance of effort dollars. Another fun fact, not so much fun, truly. The annual federal TANF block grant has been frozen since its creation and has lost about 47% of its value between 1997 and 2021 due to inflation. So that $43.8 million that we currently receive for the entire state of Nevada to serve our population has been set since 1997. So the TANF assistance program involves the TANF Child Only program as well as the TANF NEON program. I'm going to go ahead and talk about the TANF Child Only program, and then I'll defer to Maria to speak on the TANF NEON program. The TANF Child Only program is for families with a household who does not have a work-eligible adult. That could include ineligible non-citizen parents with an eligible child, and in that instance, benefits would be provided for just the child who is eligible. There's also SSI, Social Security income payment, for parents with an eligible child, and the same applies to them. There's also non-needy relative caregivers, so if you're a grandparent caring for your grandchild or an aunt or an uncle, and you're non-needy, benefits would be provided for the child or children. And then there's also kinship care relative caregivers. In that instance, the caregiver would, at least one of them would need to be at least 62 years of age, have guardianship of the child, and the child or children would need to be under their care for at least 6 months. We also have a newer program which is called the Fictive Kin Program. And that's for children who intend to be, or are foster children, placed with a fictive kin caregiver by a child welfare agency. And during that process, they are able to receive TANF benefits for the child only, for children only, while they work through the foster care licensing process. And that can be up to 6 months of benefits. And a fictive kin is defined as an individual who is not related by blood to a child, but has a significant emotional and positive relationship to the child.
The other TANF assistance program we have is the TANF NEON program, which helps households that contain 1 or 2 work-eligible individuals. Those are defined and required under some of our regulations. And the NEON program does have work requirements. They're mandatory work requirements for the work-eligible individuals. And the household must establish an ongoing personal responsibility plan, which lays out the plan for them to begin doing activities and things to work towards becoming economically independent. The program does have work, with those work requirements, there's an amount that they have to work or participate in those activities each month or each week. So if there is a single parent with a child under the age of 6, they're required to complete 20 hours of an activity, accountable work activity, each week. And a single parent with a child over the age of 6 must complete 30 hours of activities each week. In a 2-parent household, they must complete 35 hours per week combined of accountable work activity hours, regardless of the age of the children. And through the NEON program, we do provide supportive services. And NEON is New Employees of Nevada, and that is what our mandatory employment training program for TANF is called. And we provide support services to help our participants achieve those activities and their goals. We can provide things such as child care. We work with Chris's group for that. Work-related equipment, maybe they need steel-toed boots or something like that. Vehicle repair, clothing potentially, work cards if they need that for their employment. We do assist with transportation. That's usually either a bus pass, especially in our metropolitan areas, or gas reimbursement, depending on what the customer needs. We do provide stipends in certain situations and vocational training opportunities for our participants.
The TANF program, TANF NEON, also has a 60-month or 5-year time limit. We do reach out to other states to verify those time limits, and also we, of course, verify that for other states as well. Some of the eligibility requirements for TANF would be also Nevada residency. We verify duplicate assistance. For TANF NEON, well, we also verify relationship status, so we need to be able to make that connection between the family members. Citizenship or qualified non-citizenship status. Oh, and also another important one would be cooperation with child support. Behind me are the TANF income limits for 2023, and when I refer to FPL, in this instance, when we look at the needs standard, it's actually 75% of the federal poverty level. And again, that's determined based off of household size or eligible household members. Next, we'll move on to Medicaid, which we refer to as family medical coverage. We'll now look at some of the Medicaid aid codes. So we have childless adults, which is what it says it is. It's coverage for adults that do not have children. Then we have other aid categories broken out for parents and caretakers. We also have children's health coverage. We provide coverage for pregnancy. We also have a new postpartum coverage specifically that was implemented as of January of 2024, which ensures 12 months. Once the eligibility is determined for Medicaid, that mom will receive 12 months of continuous eligibility, regardless of income change. Nevada checkup. For Nevada checkup, it's for children who their household exceeds a certain income limit based off of the federal poverty level. And so for children under 6, that poverty level is anywhere from 166% to 205%. And for children 6 to 18 years old, that federal poverty level limit is 139% up to 205%. Under Nevada checkup, there are generally premiums that apply for those families. We also provide OBRA coverage for children who are born to Medicaid-eligible moms. And we provide that coverage for 12 months from the birth of the child. And then as of January of 2024, we've just implemented a program to provide 12 months of continuous eligibility to all children once Medicaid eligibility is established. We also offer up to 3 months of prior med, so when you go in to apply, you can request for us to review eligibility back 3 months. We also have programs which are referred to as presumptive eligibility, and we have that in place for hospitals where mainly it's based off of, well, it is based off of clients' or customer statement. When they're in the hospitals, there's workers there who will work with them to take the necessary information and determine if they're presumptively eligible. That does require that they follow up with the Medicaid office to establish ongoing Medicaid coverage if needed. And at that time, we would further verify the information. And then we also have that, we have the new program for pregnancy as well. Behind me, you'll see what we refer to as MAGI, income limits, which MAGI budgeting is determined by the federal government, and there's our limits listed there. Most recently, we have been able to expand coverage to pregnant women and increase that poverty FPL limit up to 190%. So you'll see that became also effective January of 2024. And so the federal poverty levels are released each January. We update those effective April of each year. And then the next slide addresses the Nevada checkup, 205% of the FPL. We also have what we refer to as MABIT, which is the medical assistance for the aged, blind, and disabled. To be considered aged for the program, you must be 65 or older. To be considered blind, you're determined blind according to Social Security Administration criteria. And then for this program, to be determined disabled, an individual must meet the disability criteria established by SSA, Social Security Administration. However, that determination can be made by either SSA or who we refer to as DHCFP, which is the Division of Healthcare Financing and Policy. I brought some extra information. I just wanted to be able to share if I could. So for Medicaid, we do look at duplicate assistance. However, and we also require that you be a Nevada resident or state that you intend to reside in Nevada. Duplicate assistance is later verified through an interface that we use to check that. In some instances, we ask about other major medical insurance. And then we also verify citizenship status or qualified non-citizenship status. In certain instances, based off of the program you were approved for Medicaid, you may be able to transition to what's called transitional Medicaid and receive 12 months of continuous eligibility as well. And then we also have emergency medical. I went off script, sorry about that. Okay. So I explained what SSI stands for, which is Supplemental Security Income. We also have, under MABIT, Qualified Medicare Beneficiary, which is also referred to as QMB. We have special low-income Medicare beneficiary, which we would refer to as SLIM-B, and qualified individual, which we refer to as QI. There's also eligibility through certain waiver programs, and we work generally with ADSD, the Division for Aging and Disability Services Division, and then institutional care as well. And we also work with DHCMP. For QMB, that covers only Medicare's copays, premiums, and deductibles. You must be enrolled or eligible for Medicare Part A. It does not provide full Medicaid benefits, and coverage starts the month after approval, and there's no ability under QMB to receive prior medical. For SLIM-B, it covers only Medicare Part B premiums. You must be enrolled or eligible for Medicare Part A. It does not pay co-payments or deductibles. A Medicaid card is not issued for this program. And its coverage does start the application month, and prior medical up to 3 months prior is available if you qualify. So for SSI, as of January of 2024, the income limit was raised to $943, and resources of SSI individuals are not evaluated by DWSS because that's already looked at through SSA. And then the last page last slide for me provides the MABIT income limits. For the MABIT program in general, resources are a factor of eligibility. There are some certain circumstances now during the unwinding where during redetermination, we have a waiver through the federal government. However, at intake, that is still required.
Okay. So now we're going to move to the Child Care and Development Program. So I'm Carissa. The Division of Welfare and Supportive Services is the designated lead agency to administer the Child Care and Development Fund, also known as the Child Care and Development Block Grant. Our program works with community partners to assist income-eligible families in obtaining safe, adequate, and high-quality child care services. We partner particularly with the Children's Cabinet in Northern Nevada and Northern Rural Nevada, and Las Vegas Urban League serves families in Southern Nevada and Southern Rural Nevada. So Nye County and Lincoln County, along with Clark County, are served by Urban League, and the Children's Cabinet serves every other county. We also partner and assist child care providers, so those centers you may know of, or family home care providers, in accessing and engaging in professional development opportunities to maintain healthy, safe, and appropriate learning environments. The block grant fluctuates year to year. So in federal fiscal year 2023, which was October 1 of 2022 to September 30, 2023, the award was about $96 million. We have a state match and maintenance of effort, just like the TANF block grant does. And as is allowed through federal rules, in 2023, our Nevada State Legislature approved a shift of the TANF funds in the amount of $10 million to the child care program, which allows us to be able to serve more children. And that makes what is termed our aggregate award about $106 million. Of that $106 million, 65 to 70% of it is spent on the direct subsidy costs. So we provide certificates to families that they take to a provider. The providers are enrolled within our program. We pay monthly subsidized costs to those child care providers directly. 12% of our funding is spent on improving the quality of available child care services, and I'll talk about how we do that in a second. 13% is spent on direct program costs such as case manager, staff, provider payment staff, childcare licensing, program operations, and then 5% is spent on program administration funding. The Child Care Subsidy Program provides child care cost assistance. And the program itself, so I generally refer to it as CCDP, is a federal and state partnership program. We provide financial assistance to income-eligible families to help them access child care affordably by paying a portion of child care costs for eligible families so that parents can work, complete job training, or finish a higher education or vocational technical program. When our income eligibility was expanded to 85% of the state median income, it essentially doubled the income family could make and still qualify for child care subsidy assistance. The child care program tends to be, under federal rules, the most generous program we can offer. 85% of the state median income is equivalent to about 245% of the federal poverty level. And currently, due to the Nevada Child Care Fund, which was an award issued to us from the governor's office, and due to the various federal relief and recovery funds that have been invested into child care since 2020, we are able to pay what's called the state maximum rate. So that's the maximum we will pay daily to a child care provider, depending on the region they're operating in, the age of the child they are serving, and the quality rating that they have. So we're paying that rate for all eligible families, and no family has to pay the required family copayment, meaning that they do not have to pay a percentage of their household income just to receive subsidy assistance, which is outside of this a requirement of participating in the program. So should federal funds decrease and force the state to return to using a sliding fee scale, these prioritized populations in the third bullet, they will continue to always receive the state maximum rate for the child care subsidy and would not be required to pay the family copayment. This does not mean that a family has no out-of-pocket cost for attending child care, since the child care provider is a choice of the family, and we do not dictate to child care providers what price they can charge. The next slide shows up to a household size of 6, the maximum monthly income a household could have to be able to receive child care subsidies. Other eligibility factors outside of income include we need identification for all household members, a social security card for all household members, ages of the children who need assistance, and household members, citizenship, the child or children receiving the subsidy. It must be a citizen or a non-qualified citizen. We need relationship to the adult household members. We need a purpose of care, that's that working in a job training program or in a higher education vocational technical program. We need to understand the household composition, the residency of everyone, they need to be Nevada residents, and their income and assets. Moving to child care quality, funds are required by the block grant. That 12% is a federal requirement that we must spend to be used for quality activities to improve the quality of child care by financially assisting child care providers in their professional development and maintaining a healthy, safe, appropriate learning environment for eligible children, which are children in these criteria who meet the eligibility criteria from age birth to 12 years old. Children up to age 19 who have special health care needs can also be eligible to keep receiving child care subsidy. We work very closely with the Nevada Department of Education, the Children's Cabinet, the Las Vegas Urban League, Children's Advocacy Alliance, and a variety of other partners I have listed on a subsequent slide to focus on quality and help providers improve the quality of the services they offer and the classrooms they maintain. So quality can include increasing skills, education levels, and professionalism of the workforce. In fact, we partnered across key stakeholders to develop the Nevada Early Care and Education Workforce Framework recently. The framework is intended to help us support a well-prepared, qualified, diverse, equitably compensated, and thriving early childhood workforce in Nevada. We ensure early childhood education professionals have access to a living wage and affordable benefits. We have strengthened and enforced program standards and policies intended to ensure a positive work environment within child care centers. We are ensuring that leaders and stakeholders have access to and can use timely and accurate data to make informed decisions about how to improve quality. And we are working to develop a policy, agenda, and public awareness campaign in regards to the ECE workforce. Low pay and benefits within the early childhood education profession often mean high turnover and limited opportunities for professional development and career advancement, which leads to what many of us know of as the shortage of childcare availability. It is not always the most enticing place to work. So increasing the wages, benefits, and working conditions for our ECE professionals will help us to stabilize childcare availability and supply across Nevada. Less turnover and decreased vacant positions will allow centers to improve the care they provide and increase their childcare capacity. Parents and guardians will have a better understanding of the importance of early childcare and education, and parents can be more involved in their children's learning to make informed choices about the centers they choose. The programs funded by the Child Care and Development Fund include, again, the Children's Cabinet, the Las Vegas Urban League. Our Nevada Child Care Licensing Program is overseen by CCDP. The Nevada Association for the Education of Young Children offers teach scholarships to early childhood professionals hoping to achieve an associate's degree or bachelor's degree. We work with what is called the Nevada Registry. That is a workforce registry that anyone working in the field of early childhood education must enroll in and receive a variety of trainings to move up a career ladder. We also work with the Department of Education's Office of Early Learning and Development, and we operate the Nevada Strong Start Child Care Services Centers. And all of these partners, you can learn more about them on nevadachildcare.org. And then finally, just a bit about child care licensing. We serve Nevada's communities by ensuring the health, safety, and well-being of children in licensed child care facilities. To achieve these goals, our staff monitor facilities for compliance with state laws and regulations, so Nevada revised statutes and Nevada administrative codes. We offer technical assistance and training ongoing to these child care providers and their staff, and we provide consumer education. The child care licensing laws and regulations are created to promote the healthy growth, development, and protection of children. The licensing staff educate state and local legislators and other state agencies to encourage support for improving the safety and quality of child care environments for Nevada's children and families. And we maintain a database that contains all current child care facilities which are licensed by the state of Nevada, except for Washoe County. Washoe County does choose to operate their own licensing program and has a website related to that where any provider operating in Washoe County can also be searched for, so you can see every licensing inspection that is available for any provider across the state of Nevada between the two of our entities. And we also develop monthly reports that detail child care capacity statewide, how many children are in each licensed facility at any given time, and that is broken out by county and city. I will turn it over to Maria.
Good evening, everyone. So I'm going to discuss first the Energy Assistance Program. The Energy Assistance Program does assist individuals or households with the cost of home energy for heating and or cooling. The program can help with electric, gas, propane, pellets, and there are some other energy sources such as heating oil that we can help with as well. When someone is determined eligible for the program, they will receive an annual one-time benefit for that program year. And we run on a state fiscal program year. And then the recipient can determine how to use that benefit, what looks best to them, and how it works for their household. We do usually pay the benefit directly to the vendor, and it would show as a credit on the account. The Energy Assistance Program is federally funded, as well as we have state funds. The federal funds are from the Low Income Home Energy Assistance Program, or Light Heat Block Grant, and the state funds are generated from the Nevada's Universal Energy Charge Fund. Currently, we also have the Water and Sewer Assistance Program, which does also help with water and sewer costs for individuals. The eligibility criteria is the same as the Energy Assistance Program, and the program will be available until March 31st of this year, and it was funded with federal dollars. To be eligible for the Energy Assistance Program, a household must meet the minimum qualifications, which include citizenship criteria, Nevada residency, household income that does not exceed 150% of the federal poverty guidelines, and you can see that on the screen there. And the household must be responsible for paying home energy costs. And for the Water and Sewer Assistance Program, those criteria are the same, but they would need to be responsible for paying water and sewer costs. So the next slides go over some of our programs or other services at our other division. The first one is our Workforce Services and Development Unit division, which houses the Recovery Friendly Workplace Unit, the Workforce Development Unit, and the Homeless to Housing Unit. The Recovery Friendly Workplace Unit provides support to those impacted by substance abuse use disorder by identifying recovery-friendly employers and removing barriers to stable employment. It helps individuals across access community resources and services that are identified as needs. So that particular unit, they find out that someone needs assistance, and they will work with that individual, talk to them, and help them determine what kind of resources and services they need, or they help them determine, like the communication between the two. And they reach out to community partners that they've established relationships with to help those individuals. Our Workforce Development Unit, they assist both our TANF NEON customers as well as our SNAP customers to help them find employment, or really career pathways that lead to livable wages and upward mobility. That unit does work on different community projects that benefit underserved individuals. One of those projects is Project 354, which addresses the disproportionately higher unemployment rates of underserved individuals between the ages of 60 to 24 in certain area codes, or zip codes, I apologize. They also work with Nevada's Disconnected Youth, Nevada Immigrant Workforce Development Project, with the Governor's Office of New Americans. Our Homeless to Housing Unit provides administrative support for the Nevada Interagency Council on Homelessness, and they also are working to establish a Nevada Housing Crisis Response System. One of the other things that we have at our agency is the Targeted Outreach Partnership, and through what we call TALK, the Nevada, our division, has staff that work in the community to meet customers where they're at. We have individuals at over 190 sites throughout the state. They're both virtual and in person, and we are working to expand. They also attend local community events statewide, so they can provide information about our programs as well as different eligibility criteria. Our staff are located at hospitals, correctional facilities, homeless shelters, schools, health centers, libraries, and within other community organizations, so individuals can access those services. And we could, on the next slide, it kind of shows how to apply for benefits. For SNAP, TANF, Medicaid, you can go to Access Nevada where it says click in, or you can call. Individuals can call in at either of those numbers listed, or even visit our website that lists our offices and different sites. For the Energy Assistance Program, we are not available in Access Nevada. However, individuals can fill out their applications, they can mail them in, they can fax them in, they can email them to the Energy Assistance email account, as well as take them to any of our welfare district offices throughout the state and drop them off, and they will come to the Energy Assistance Office. And we also have intake sites across the state of Nevada that would take in our applications. And then for child care, they can go to the nevadachildcare.org website. And that is the end of the slideshow presentation. Questions?
If the audience has questions, we're collecting your cards. We have some beginning questions. You showed a slide that had amounts, and we didn't say if they were monthly or yearly amounts.
Let's see, for the Energy Assistance Program, those were the maximum monthly income limits.
And the amounts for SNAP, TANF, and Medicaid and MABIT and Nevada Checkup all would also be monthly amounts.
Another question ahead of time was, what does qualified non-citizenship mean?
So there are specific criteria that an individual has to meet the requirements of a qualified non-citizen, and there's quite a few different requirements for that.
I don't want to misspeak, because there really are. There's pages and pages of things we have to work through. So narrowing it down, I'm afraid I might miss some. I would miss probably quite a bit of it.
That's what I was worried about too.
Yeah. I will say that for non-citizens, that the program that they could apply for would be emergency Medicaid. One thing I wanted to clarify too, that for the Division of Welfare and Supportive Services, we do Medicaid eligibility, so we determine initial eligibility based off of the criteria. From there, determining what services are available to the individual based off of their eligibility is actually determined by DHCFP. So I think that's a big distinction to make. So even what made me think of that was emergency Medicaid, we don't ultimately determine if any services would be covered. We just determine that initial eligibility based off of their citizen or non-citizenship status, truly. And then from there, DHCFP would review to see if they truly meet the definition of what they've determined to be in need of emergency medical services.
What is the federal poverty level in general?
Good question. I don't know that. I think we just more provided we can break that down based off of our per household amount and only give you the monthly amount, and that's what those tables show. So for SNAP, for example, actually, our amounts show that 130% of the federal poverty level. As we go on and ask more questions, I can probably pull that up though.
Okay.
And give you amounts.
Do Native Americans who live on a reservation qualify?
Yes.
Yes.
In most cases, yes.
So specific for TANF, the only tribe in Nevada that has chosen to operate its own TANF program is the Washoe tribe. So if you're receiving TANF through the Washoe tribe, that would be considered duplicate benefits. But outside of those instances, then yes, if they meet eligibility criteria, they absolutely can.
Okay.
And for the child care program, so yes, Native American families, so American, Indian, Alaska Native children are dual eligible for federal and Native child care subsidies. There are only 8 tribal entities in the state of Nevada that receive their own child care assistance from the federal government. Many times, if any of the children on the reservation can't get into the reservation child care center and end up in a private facility outside of the reservation, then they're going to also be eligible for our subsidy assistance.
And the same is true for energy assistance, individuals who are living on reservations may qualify. And then for the NEON program, if they're eligible for the TANF program, then they would be mandatory participant of the NEON program if they are out of work eligible individual.
Right, and I think it's important to note that those families also still have to meet all the same income and eligibility requirements that any other families have to meet.
And then for SNAP, same eligibility requirements. However, if they're receiving food commodities, then they would not be eligible for SNAP.
Are the number of clients going up or down in the last few years?
So the figures do fluctuate year to year. Over the past decade, I believe that was one of our pre-questions we prepped for, was our child care, SNAP, and Medicaid enrollments have all seen an increase in recipients since 2016. This information is also available on what is called the DWSS Fact Book, which can be accessed from the DWSS website. And then conversely, the TANF NEON and TANF Child program enrollments have both seen a decrease in benefits from 2016, or a decrease in enrollments.
Can you estimate the approximate number of people in Nevada who are getting aid?
So I have average monthly numbers, which come from our Office of Analytics. So for SNAP recipients, I can tell you in SFY 2020, and SFY is July 1st of each year through June of each year. So in 2020, for SNAP, we had 436,847 recipients on average per month. For, let's see, SFY 23, which just ended in June of 23, we were at 484,600. And as of October, that's the last number I have, of 2023, it was an average of 507,021. For Medicaid recipients, this excludes Nevada's checkup numbers. In SFY 2020, we were at 656,977. In SFY 2023, we were up to 919,333. Currently, we're going through the unwinding process. Now, I will say that in SFY 23, we were under federal guidance to provide continuous eligibility. So we were not terminating or decreasing Medicaid benefits at that time, which is why you see that huge increase. Because everybody was remaining on regardless of eligibility, and then of course additional people would apply and obtain eligibility. Currently, as of December, as we're going through the unwinding, which again was guidance provided by the federal government, we have resumed redeterminations and reviewing eligibility. And as of December, actually I don't have December numbers. As of November, we are at 891,641. For TANF in SFY 2020, our numbers were 21,032. Yes, just 21,032. In SFY 23, that number was 15,655. And as of November of 23, 14,764.
And for the Energy Assistance Program, for this program year in 2024, through December of 2023, we had served approximately 6,500 households so far.
And for the child care program, we can say that we provided, in calendar year 2022, we provided subsidies for 14,624 children. We will do another calendar year data run for 2023, probably in March when we have clean data.
Thank you. If a household has 2 older people and one needs to be institutionalized, what happens to the remaining spouse left at home?
Can you expand on what you mean by what happens to the spouse left at home?
Who asked the question?
I'll do it. I'll do it. So if they are together, their income, they're slightly over the limits. What, is there still an impoverished spouse method? So you don't force the one that's still living in the house to become now impoverished to care for the one in the institution. So I thought it was that you should explain that to people.
So what I could do, I will say, unfortunately, my Medicaid specialist, who is supposed to be here tonight, I don't have a direct answer, a complete answer for you. But what I'd be happy to do is get your information, and I can share a response. Brian Studebaker is our Medicaid specialist, who couldn't make it this evening, but he would be able to provide you with any information you need regarding that.
I just think it's something that people don't realize. There's ways to income split and not force people out of their home that have lived in it for 50 years. Anyway.
Absolutely.
It would be a great thing to get out to people.
I agree. And there's other programs that we have as well, such as the Katie Beckett program, which assists children who would possibly be better served at home. So again, there is information, some good information on our website. Our manual, our policy manual, is available at dwss.nv.gov. And that's a good resource as well, but I'll be happy to get your information. Anybody who wants any information on any particular program or circumstance, I'm happy to give my information out as well, or our public information officer, Crystal, and she'll be sure to give the information to me as well.
Yeah, I'll just jump in for Crystal because she's likely taking notes, and we can just make sure and get from Ryan a response to the question to get back to you to
Thank you.
everyone.
And on that note, there was a question of, can a copy of your slides be made available?
Absolutely.
What percentage of Carson City households are food insecure? An estimate.
I do have that. I just forgot to print it out, so let me look that up. I do, however, have federal poverty level amounts. Let's see. What I have here, it starts with a family of 2. For 2023, 19,720. For a family of 3, 24,860. For a family of 4, 30,000. For a family of 5, 35,140.
Tanya, can you say which website you're using?
For this, I pulled up healthcare.gov, but it's universal.
Okay. And there's a conception amongst a lot of the public that people who are getting TANF and Medicaid and the services are better off than the people who are working. So can you say something to that?
I can
specifically speak to TANF and the amount that these families get. Chris, I don't know if you're able to pull up that slide again, but of course, this slide doesn't have the amounts. The amounts that these families receive are extremely low in comparison to if you were to be employed. I will say, though, that one thing with our program, with our TANF program, are there's these other supportive services that can be provided. So for families who could use the benefits of training opportunities, work cards, transportation, childcare is a huge one. There are benefits, but by no means is the TANF benefit amount sufficient to care for a family. The bigger piece of that, Maria can speak to it, would be the supportive services.
Well, and I think another important thing is that just because someone is on our benefits does not mean they're not working. We have many individuals who are actually working, and they still are just not making enough to be over the poverty lines for the programs. And I think that's important to know, that many of our folks do work and are trying to support their families. And these are supplemental programs. In regards to the TANF program and the employment and training program, there are supportive services to help individuals overcome some of the barriers to employment that they may be experiencing. And that can be vocational training, that can be soft skills training, just assistance with job search. And they're very specific criteria, and they have to meet those hourly requirements. There is a lot of restrictions in the program, and if they don't, they're no longer eligible for the program because it is a mandatory program. So I think it can be a lot for a family to meet all the federal requirements for our programs. Also, if someone's receiving SNAP, we do have a SNAP employment and training program that is completely voluntary. And individuals in that program can get job search assistance and even educational opportunities they can obtain. And there are support services in that, but those are much more limited than our NEON program.
So I found the current payment allowances for TANF as well. So for a family of one, when I say a family of one, that would be a circumstance such as a TANF child household where the parents may not be eligible. So the benefit amount is specific to the eligible child. So the payment allowance for that child, the family would receive $254 per month. For a family of two, that's $320. A family of three, $386. And I'll go up to a family of 8, $716. There's that's for the NEON program, for TANF overall, but what I do for kinship care, so that's when you have a non-native caretaker, 62 or older, that meets the other criteria I mentioned. If they are caring for a child between 0 to 12, it's $401 for each child. For a child 13 or older, it's $463 for each child.
Thank you. How does a homeless person show Nevada residency?
Client statement.
Okay.
Client statement, so self-attestation.
And does your department work with local homeless organizations or other organizations like FISH and whatever's in Las Vegas?
So we do have the homeless to housing unit, which does work with different community agencies and reach out to them, as well as even our NEON program, we have social workers who are case managers for our highest risk individuals that are receiving assistance, and they would reach out and help individuals if they were homeless or at risk of becoming homeless. We do, even though we might not have formal partnerships, we do definitely have relationships with a lot of the businesses and social services out there. We'll make phone calls.
And in the child care programs, specifically those partners, the Children's Cabinet and the Las Vegas Urban League, they're the entities who employ the case managers that work directly with the families receiving the child care subsidies. And they do much of the same thing. They know the local resources and are the ones speaking with the family on a regular basis to ensure that if they're experiencing homelessness or at risk, they can connect them to the best local resource that will help them.
What steps would need to be taken for the state funding to be brought up to speed with the 2024 cost of living?
Well, I can say that, so it takes local advocates a lot of the time speaking to the Nevada State Legislature and their assembly person or state senator for state. So if you're talking about state funding and having more state dollars invested in the welfare and support services programs, it often takes obviously at the local level to help advocate for that to increase the state match or input of the budgets, and the same thing on the federal level. So many of these programs, if they're not population driven, do take the state congressional delegates hearing from their local constituents.
And you mentioned this a little bit, but what steps do you take to make the public aware of programs and services, especially in the rurals?
So we of course have our Division of Welfare and Supportive Services website, where all of the programs can be found listed. So we also have local welfare offices in the majority of counties, if not all counties. I'm not sure, say Eureka County has an office, but the majority of rural counties have a local welfare office. We also have a customer service line. We have our targeted outreach partnership program, and they have workers within the communities, for example, with sites related to Department of Corrections. Maria could probably go over them more clearly. And then for childcare, I can speak to specifically the NevadaChildcare.org website is a consumer-facing website, so it's not as like intensive as going to the state website, and then that kind of speaks to, oh, am I a parent, am I a child care provider, and you can click through to find the resources available for your specific need. And then where does COP go?
So I know they're at over 190 sites across the state of Nevada, and they do it both virtually and in person. So a lot of that does help. And for the energy assistance program, we have intake sites across the state, which are community-based organizations that assist individuals with applying for energy assistance. So they even help gather all the required verification, get those applications completed, and they'll mail them to our offices. Also, for energy assistance, Nevada Energy and Southwest Gas have us on their website, listed on their website under things or programs that can help to pay for the program, their costs, their energy costs. And also, energy assistance is also listed, if they still get a hard copy bill, it is listed on all Nevada energy utility bills. And then for SNAP ENT, our employment training program, our contracted educational providers, which not necessarily in the rural areas, but they do help the students, eligible students, enroll for the program.
And then as far as how people hear about the services, I mean, we also have the Nevada DHHS website, which is the Department of Health and Human Services. the Nevada 211 website, social media platforms, counties, hospitals, and many, like we were saying, partners. Speaking of homeless shelters, the Courtyard in Las Vegas. There's places such as Catholic Charities where people can go to apply for benefits as well.
How long does it take from the beginning to application until someone can get assistance?
So for SNAP, we will evaluate for expedited services, which means they should get their benefits no later than the 7th day. So that's a possibility, depending on their circumstances and if they meet the criteria. For Medicaid and TANF, it can take up to 45 days to process the application. And I can't believe I'm blanking on SNAP, I want to say 30. So those are the maximum timeframes for evaluating and determining eligibility.
Same for childcare in terms of 30, it's 30, like a maximum of 30 days. If they send in the application, everything and all of the identifying documentation that's required, it can go faster than that. Let's say it could go within 10 business days, 7 to 10 business days. If the case manager is needing to follow up to get more information, then it can push it out to the 30 days. But for childcare, their assistance would go back to the date of their application. So it would start the first, even if it wasn't fully approved until the 30th.
And so we have for SNAP, TANF, Medicaid, MAVIT, of course, we have a process that we refer to as one and done, our business process re-engineering, BPR, where if the individual is in front of us, so when they come into the office, we will bring them back and we will work every bit of that case we can. So if we need a verification and they don't have it right in front of them, there's interfaces that we check and we try to run. We will also attempt a collateral call to see if we can verify by phone. So we do everything we can to try and determine eligibility in that one touch. If we have to, we'll pend the client for 10 days for anything we're not able to verify with them right in front of us or at the time that we pull their application, through an electronic application or through Access Nevada.
Does Nevada outsource any of your programs?
Oh, in particular, the child care program works with the Children's Cabinet and the Las Vegas Urban League. So in the sense of those entities are looking through the application and they're running the eligibility. So in the word outsource, that we work with them to do that. And then they process the provider payments, which comes through us to approve and then get paid out to the providers who are providing care for those eligible children.
And then for the Energy Assistance Program, it's a requirement of our federal and state funds that we subaward some of the funds to our weatherization program, which is operated by the Housing Division.
Okay. Are there funds left over at the end of the year that were not accessed because of maybe people didn't apply for them?
In some instances, funding is not always fully utilized within the same fiscal year. There's a multitude of reasons why funds may not be fully expended by the end of the fiscal year. This may be attributed to invoices not yet received by the state agency and/or the need for reconciliation of expenditures for agencies for which funds were subawarded to. Another common reason is due to personnel vacancies, and we have seen a lot of that most recently. Personnel vacancies do not only impact salary savings, but also impacts the implementation of projects and services to customers. Without the proper staffing, agencies may be unable to implement certain services, contracts, etc. So yes, in some instances.
Can the money roll over?
So each program has their own requirements. For SNAP, we have 2 years to expend the funds.
In childcare, the block grant is on a 3-year basis, so from year 1 to 2 to 3. Some of the funds can roll over and you have to liquidate by a certain period. And recently, I have some stats, we've returned like less than 2% of our total funding.
And for TANF, it's also a block grant. We don't have that requirement, at least at this time. So those funds will roll over, but we must use the oldest funds first. Another thing I wanted to mention when we were talking about funding and that $43.8 million. With that, and Carissa mentioned the MOE, maintenance of effort, we do have the requirement through the TANF program of we have to expend state dollars no less than 80% match at just over $27 million as well, on top of the funding we receive from the federal government. The state must expend that annually.
I think the last question is concerning fraud. There's such a conception that there's welfare fraud.
So for fraud, what we've actually seen is an increase in fraud that's negatively impacting our customers with the cloning and skimming of EBT cards. We're working with our national partners to determine best practices and other ways to prevent and reduce the cloning and skimming. So we have individuals who are...
Of what kind of cards?
They're EBT, which is electronic benefit cards, transaction cards. It looks like a credit card, and it is where their benefits, their SNAP and TANF benefits are deposited.
Okay. Is there anything that you want to add before we close?
Let's see. I was going to mention, we talk about other funding, which for such as the TANF program, we don't get that opportunity very often, but through ARPA funding, we had the Pandemic Emergency Assistance Funds, and we were initially awarded almost $6.8 million. So we were able to bring that into the state of Nevada and expend that through helping through like diaper assistance. We had to expend it on non-recurrent short-term benefits. We also provided supplemental payments to our TANF customers to receive money for back-to-school needs and winter clothing. So we were able to do that, and by doing that, if we expended all of our funds, we were eligible to receive a second award based off of what was left within the ARPA funding. So right now we're working, we're getting another roughly just under, I think, or right around $780,000. So we're working to do another supplemental payment to our TANF customers.
I want to add, our staff, our field and our frontline staff work really, really hard every day to determine eligibility for all of these programs and find community resources for individuals in front of them and trying to help them and assist them. And they're absolutely amazing with what they do every single day to get benefits to the most needy Nevadans.
And I'll just add for childcare, in following along with what Tanya said. So during the height of the pandemic and through the various relief and recovery efforts, particularly the American Rescue Plan Act, that allowed all states, including Nevada, to provide what were called operating stabilization grants to childcare facilities across our states. These grants helped enormously hundreds of Nevada's child care facilities to stay open so that they could provide child care services first to the essential workforce that was still working, your paramedics, your doctors, everyone. And then for those returning to work after the core shutdowns ended. And having a child care available to the workforce allows parents to continue working, to provide an income for their family or to achieve a higher education or vocational technical certificate so that they could achieve a higher income. We know childcare providers have reported to us that without those stabilization grants, many of them would have had to shut down their businesses completely, leaving working families with few to no options and reducing our workforce in Nevada further. National research also shows that as childcare facilities closed or restricted capacity during the pandemic, many working parents were making tough decisions to leave the workforce, particularly working women, to care for their child, which caused their households to further lose money. So those were essential grant funds that helped Nevadans keep working.
And going off of what Marissa said about how it also assisted our workforce, this is my plea for anyone who knows anyone who is looking for employment to please apply for the Division of Welfare and Supportive Services. I can't stress enough how important it is that we fill our vacancies so that we can serve our needy Nevadans. So please, if anyone knows anyone, please have them apply.
The state is hiring.
Thank you all for coming. I hope you'll come to our next one in March about aging. And thank you all of the presenters.
Thank you.